Okay, so we have finished her anterior maxillary distraction. So we have done a distraction of around 10 mm for her. As you can see, there is a clear gap between the osteotomized segment between the molars and the premolars. So later on, we'll be using this gap to decrowd the teeth. So you can see there's a lot of crowding for her. So we'll be aligning the teeth in that area, taking approximately 10 mm both sides, which is going to help us align the teeth properly. So this device is going to stay in the mouth for another 6 months. So as you can see, we have blocked the screw here, so it doesn't move for the period of 6 months. And till the time the bone matures, the device is going to stay in situ. And after 6 months, we'll remove the device and start her orthodontic alignment of teeth. Extraoral also, you can see the difference between the profile pre-surgery and post-surgery. So there was a nasolabial depression bilaterally before the surgery. So now we can see this a good nasolabial fullness as well as positive jet. Agaro, thoda muh band karo, band karo, band karo. So you can see the anteriors, the upper anteriors have come ahead of the lower anteriors. So the patient is in positive jet right now, along with a good nasolabial fullness. So further planning is again, she'll be undergoing orthodontic treatment after a period of 6 months. And once the orthodontic treatment is done and the teeth are well aligned, we'll be planning her definitive rhinoplasty.